Now guys, let's continue with the topic of barrier methods of contraception. But before going into barrier methods of contraception, now let's see some important topic which is very important for the exam. Guys, let's see what does it mean by a Pearl's index. Guys, what does it mean by a Pearl's index? Is used to measure the failure rate of a contraceptive. In an easy language, with the help of Pearl index, we can know how bad the contraceptive is. Okay, so let's see the definition. It's the number of contraception failures. Okay, so Pearl index is giving an idea of a number of contraception failures are happened for that particular contraceptive agents. Okay, you can have Pearl index for condoms, you can have Pearl index for IUDs, you can have Pearl index for even natural methods of contraception, you can have Pearl index for OCPs. Okay, so different contraceptive methods have their own Pearl index. So one important point is Pearl index gives number of contraceptive failures per 100 years of woman exposure. So a woman is going to use this contraceptive method for 100 years. Okay, let's take it like this. A woman is going to use this contraceptive method for 100 years. So in that 100-year period, how many times that this contraceptive is failed? Okay, so that's what, in a simple way, we can say what is a Pearl's index is. Now let's see an important formula which is very important for the exams, that is Pearl index formula. See, it's the number of accidental pregnancies happened. Okay, so even with the use of a contraceptive, how many number of accidental pregnancies happened? In how much time period, guys? We have already seen in 100 women period. Okay, in 100 women years. Okay, so usually per month there are 12 months into 100 years, so that is 1200. So how many accidental pregnancies happened into 1200 months by number of women in study? Okay, so how many women you are taking? Okay, it can be 1 or it can be 10 or it can be 100. Okay, and what is the duration of the study? So how many months she was exposed to that, like a contraceptive, okay, in your study. Okay, so if you substitute all the requirements, then you will be getting a Pearl index for that contraceptive agent. Simple. How easily the contraceptive is failing, or how many times the contraceptive is failing, that you can know by a Pearl index. Now guys, this is a very important slide that even in exams they will be keep on asking you that male condoms have a Pearl index of a 2 to 14, and in some books mention 2 to 18. Okay, so what is this, guys? If a male, if he is using those male condoms perfectly, so perfect use rate, so the Pearl index value will be 2. Means it can go wrong 2 times, perfect use, or it can go a maximum of 14 times. Okay, it can fail 14 times in the 100 women period. Okay, 100 women year period. Now the same Pearl index value is 5 to 21. And Mirena, what is this Mirena, guys? Mirena is the levonorgestrel containing intrauterine device. For the exams is very important. The Pearl index of Mirena is 0.2. So you can see that there is no need to explain one by one. So see, copper containing intrauterine devices and oral contraceptive pills and diaphragms, implants, like male and female sterilization. So each and every contraceptive method have its own Pearl index value. But important is, out of all, which contraceptive method have the least failure rate? Means it usually won't go wrong. Okay, so most of the time it won't go wrong. What is that? It is the implants. Please concentrate. Implants have the least failure rate. Okay, especially Implanon. I think you know this. Okay, Implanon, Nexaplanon. The implants have the least failure rate. Okay, don't worry, we'll discuss about the implants in the next video. Now let's continue with our barrier methods of contraception. See, in the name itself it's there. It's a barrier method. Means we are creating a barrier so that sperms are not going to meet the ovum. So we are creating a barrier so to prevent the fertilization. Now, so barrier methods includes condoms, and condoms are of two types, male condoms and female condoms. Now let's start with the male condoms first. So these male condoms should be used only once. Why this is that important? Why? Because female condoms can be used more than once. Okay, male condoms, important point, it should be used once. Should not be inflated for testing, okay, to see whether there is any breakages or any small perforations. Okay, the person should not inflate it, okay, before using. That's not allowed. And oil based lubricants should not be used. Okay, for the process of lubrication, the person was not supposed to use the oil based lubricants such as Vaseline or cold creams. Okay, these are not allowed. Why? Because using such kind of creams will cause the breakage of condom. It's very easy that these condoms may break with the use of that oil based lubricants. But if the person is willing to have some kind of an extra lubricant, so he is allowed to use he is allowed to use water based lubricants. Okay, so water based lubricants like a KY jelly can be used. Now, spermicidal jellies or agents can be used to increase the effectiveness. Okay, along with the condoms, if the person want to use some additional adjuvant, he can use spermicidal jellies. Why? Because these spermicidal jellies are the chemicals which kills the sperms on contact. Okay, and even these spermicidal jellies will increase the lubrication also. Now, in case of rupture, what if this condom is ruptured, or what if the condom is slipped? Now, there is a chance that a female can become a pregnant. So what to do now? So in the case of rupture, she should take emergency contraception within the next 72 hours, or as fast as possible she should take the emergency contraception. I think most of you guys know it. What is meant by emergency contraception? Okay, eye pills, okay, which contains levonorgestrel of 1.5 milligrams. Okay, don't worry even if you don't know. Why? Because we will discuss emergency contraceptives, okay, in the next videos. So what to do? If there is any breakage or slippage of the condoms, the female should immediately take emergency contraceptive pills as fast as possible. Along with that, she can keep spermicidal jellies inside her vagina to kill the sperms. Now, after seeing male condoms, let's see some advantages of these male condoms. What are the advantages, guys? See, these male condoms will provide good protection against STDs and pelvic inflammatory disease. Okay, so they will hinder the transmission of the sexually transmitted diseases like chlamydia, the sexually transmitted HIV. Okay, now, and also these barrier methods decreases the risk of cervical cancer and cervical dysplasia. For example, what is the cause of cervical cancer, guys? It's the HPV virus, and HPV virus is going to come into the female via sexual route. So, using of condoms will decrease the transmission of this HPV virus. So, in turn, that will also decrease the chances of cervical cancer. Okay. Now, what are the non-contraceptive benefits? Okay, there are lots of contraceptive benefits. The first benefit is no pregnancy. Other than that, there are no sexually transmitted disease transmission, and there are no pelvic inflammatory disease, no cervical cancer. Okay, well and good. Now, what are the non-contraceptive benefits? Non-contraceptive benefits are these condoms can be used as a condom catheters. Okay, most of the males who are elder males, they don't want you to put the Foley's catheter. So those who are refusing to have a Foley's catheter, those persons, you can use these condom catheters. It's very easy to apply. Okay, and most of the time they won't refuse this. Now, condom tamponade for atonic postpartum hemorrhage. Guys, you can concentrate here. What is PPH, guys? Postpartum hemorrhage. Which means that there is too much amount of bleeding after the delivery of the baby. Postpartum, there is hemorrhage. So, now what we can do? See, as there is hemorrhage happening, you need to strongly oppose the bleeding blood vessels. Okay, you need to strongly oppose them. For that, in this case, what we are doing is, we are going to fill a condom with a warm saline. Almost 500 ml of warm saline is kept into the condom, and this condom, inflated condom, is going to be kept inside the uterus. Okay, we are going to inflate this condom inside the uterus. So what happened, guys? This 500 ml of a warm saline is going to exert pressure on the uterine wall, and also this 500 ml of wet saline, warm saline, is going to exert pressure on the bleeding blood vessels, so bleeding will decrease. So it can be used as a condom tamponade. And in female with anti-sperm antibodies, guys, some females may have cervical factor of infertility. What is the cervical factor of infertility? Already we have discussed that cervical factor of infertility, the mucus, cervical mucus, is not receptive for the sperms. And even sometimes the cervical mucus contain anti-sperm antibodies. So in this condition, the male was asked to use the condoms for the next 3 months. So the anti-sperm antibodies which are present in the cervical mucus may decrease after 3 months. So in a female with anti-sperm antibodies, the male partner was asked to have the condoms for the next 3 months, and we can give the female partner with the corticosteroids. Why? Because the corticosteroids are immunosuppressants. So these corticosteroids will also decrease the anti-sperm antibodies. See, corticosteroids for the female partner. What about the male partner? Ask the male to use the condoms for the next 3 months. Okay. After this, let's see some important points about the female condoms. Guys, in the background you can see, like, a big condom, a big plastic bag like thing with 2 rings. Okay, here there is 1 ring and here there is 1 ring. Okay, so they will definitely ask you which condoms have 2 rings, guys. Female condoms have 2 flexible rings. Okay, now let me show you other image so that it will be more clear. Guys, please concentrate here. This is 1 ring and this is the other ring. See, the ring, this ring is at a closed end. Okay, 1 ring is at the closed end and the other ring is at the open end. Guys, the ring which is present at the closed end is going towards the cervix, and the ring which is present at the open end is covering the vulva. Okay, outside. See, this closed ring is going to closely adhere to the cervix. Now, please concentrate this point. Ring at a closed end covers the cervix and the ring at the open end covers the vulva. Okay, now point is, after intercourse, usual intercourse is happening within this cavity of this plastic bag. That's a polyurethane bag, and this can be removed soon after the intercourse. Okay, just immediately after the intercourse, this condom can be removed. Female condom can be removed and it can be used more than once. Important point is, guys, usually certain barrier methods should not be removed just after the intercourse. For example, later we'll be discussing about cervical caps, cervical diaphragms. They should not be removed immediately after the sexual activity. But female condoms can be right away removed after the intercourse. Okay, there is no problem. What about the disadvantages, guys? There is no problem. Condoms, female condoms have high failure rate. Male condoms is 2 to 14. But female condoms is 5 to 20. Now, risk of toxic shock syndrome and risk of urinary tract infection. Why? Because while she is trying to insert these condoms, she may take some bacteria from outside and she can lodge it in the urinary tract or in the vaginal reproductive tract, possible. So there is risk of toxic shock syndrome and urinary tract infection, and it interferes with the sexual pleasure. Okay, even male condoms and female condoms, they will definitely have some amount of impact on the sexual pleasure. Now after this, see, this image is very, very important. You should know what is the female condom. Okay, image based question is very, very important. Now after this, let's discuss about today. Guys, in the exam, if they ask you today is, don't just say that today is Wednesday or Saturday or Sunday. Today is vaginal sponge. Okay, today is vaginal sponge. So let's see some important points about this barrier method. So it's a mushroom shaped polyurethane sponge, and this barrier method contains 1 gram of nonoxynol 9, and it is provided with a loop. Guys, image based question, very, very important. It's going to have a loop. Okay, it's going to have a loop and it contains 𝐸𝐴𝑛𝑜𝑥𝑒NOL 9. See, even here, the today's sponge, it contains 𝐸𝐸𝑛OL 9. What is this 𝐸𝐸𝑛OL 9? 𝐸𝐸𝑛OL 9 is a spermicidal agent. It's going to kill the sperms on contact. Okay, so how this is going to be helpful? It's going to create a barrier. Okay, it's going to create a barrier, and it prevents the entry of sperms into the cervical canal, so that the sperm and ovum, they are not going to meet, so that there is no fertilization, no pregnancy. Now, important point here is, guys, remember, female condoms can be removed right away after the intercourse, but cervical, vaginal sponges cannot be removed or should not be removed immediately after the intercourse. They should be kept in place. Okay, they should be kept in place for the next 6 to 8 hours. For the next 6 to 8 hours after intercourse, you should not remove them. Okay, only after 6 to 8 hours a female can remove her vaginal sponge. Okay, this is a very, very important MCQ, and this is one time use only. Okay, she can use only one time. Now, guys, image based question are very, very important. After this, let's discuss about the vaginal diaphragms and cervical caps. Guys, see, these are the cervical caps. Guys, please concentrate that these cervical caps do not have a loop. If you find a loop, it's a vaginal sponge today. If there is no loop, it is a cervical cap. And this is a diaphragm, and this is also vaginal diaphragm. See, these are also used as a barrier method, just like condoms and sponges. They can also be used as a barriers, not letting the sperms to meet the ovum. Should be always used with the spermicides. Okay, usually today the vaginal sponge, it have its own spermicides, but you have to apply spermicides over it, and you should use them, okay, to increase their effectiveness. Should not be removed until 6 hours after intercourse. Okay, just like vaginal sponge, even the vaginal diaphragms and cervical cap should not be removed immediately after the intercourse. They should be kept in place for the next 6 to 8 hours. Important. Image based questions, guys, important. This is the diaphragm, cervical cap and cervical cap. Okay. Now, after this, let's discuss about the contraindications for diaphragm. In which conditions a female should not use a diaphragm? Very, very important. Lots and lots of time this question was asked. See, in the conditions of uterine prolapse, rectocele and cystocele. For example, please concentrate. Just think rationally. Okay, if there is a uterine prolapse, okay, will a female should use diaphragm? That's the time for intercourse? No. In the conditions of uterine prolapse, rectocele and cystocele, please concentrate. In rectocele, the rectum is going to move anteriorly. Okay, the rectum is going to displaced anteriorly, narrowing the reproductive tract. And in cystocele, the bladder is going to fall posteriorly, again making the reproductive tract narrower. That's making the vagina narrower. See, in these conditions of rectocele and cystocele, if a female is trying to insert the diaphragm, that may rupture this rectum, or that may rupture the wall of the urinary bladder. That will cause rectovaginal fistulas and vesicovaginal fistulas. Okay, that can form rectovaginal fistulas or vesicovaginal fistulas, which is not desired. So, in uterine prolapse condition and rectocele condition and cystocele condition, these are absolute contraindications for the use of diaphragms. And even in the retro version of uterus, okay, there is retro version of the uterus, don't use diaphragms. Why? Because those diaphragms can at any time they can easily displace. And even vesicovaginal fistulas, if there is already a vesicovaginal fistula, no, don't use diaphragm. And severe cervical erosions or lacerations, already the cervix have lots of erosions. Okay, it's already red hot tender, it's having lots of lacerations. In that conditions, when you try to put some material over it, because of abrasions, the condition is more aggravated. So don't use a diaphragm in the conditions of cervical erosions or lacerations, and the patient is having recurrent urinary tract infections. Don't use a diaphragm. Why? Because you may accidentally or unintentionally lodge some bacteria near to the urinary tract. That will again cause a urinary tract infection. Now, after this, let's see the topic of spermicides. Okay, so what are these spermicides, guys? Spermicides are the chemical agents. Okay, these are the chemical agents that will kill the sperms. What are the most important chemical agents, guys? We have already seen it's the nonoxynol 9 and octoxynol and menfigol. These are the chemicals that will kill the sperms. Very important MCQ is what is the mechanism of action. Even in PSM this question will come. See, the mechanism of action is upon contact, these spermicides will cause the disruption of the cell membrane of sperms. Okay, the cell membrane is going to disintegrate so that a sperm will be killed. Okay, see here, murdering all the sperm so that the female is not going to get the pregnancy. Okay, so these spermicides should not be used alone. Why? Because lots of failure rate. So these spermicide should be used as an adjuvant with the other barrier methods. They can be used with the condoms, they can be used with the female condoms, male condoms, they can be used with the diaphragms, they can be used with cervical caps, and with today vaginal sponge already it's filled with the nonoxynol 9. So you should not use it alone because of high failure rate. So always use it in conjunction with other barrier methods. Okay guys, barrier methods, I hope you guys understood it. Now next, let's continue with the oral contraceptive pills. Okay, thank you.